Derek was 17 when he took his first pill, and he died just 2 weeks after his 18th birthday. Even after my child died, that certainly wasn't the end of it. Other people died. One of my son's best friends, when she was 20 years old, told me that she had already been to 11 funerals of friends that they all grew up with.
The United States is in the middle of an opioid crisis. Nearly 100 people a day are dying just from opioid overdose. One of the most effective responses to the opioid epidemic is through a frontline public health intervention known as syringe exchange. Syringe exchange programs not only give clean needles to people who are using drugs, they take dirty needles off the streets. They also reduce HIV and hepatitis C transmission and offer naloxone, the overdose reversal drug, to reduce overdose deaths. Right now, there is only one syringe exchange in the state of Florida, and that's in Miami.
We were to find needles here in this patch of grass. You used to be able to find a lot of needles under those trees. Don't find them there anymore. They know that for every needle they bring me, I'm going to give them a needle.
We have this wonderful program for people here in Miami, but I feel that until this is in the entire state, we cannot stop. Unfortunately, Florida's had the highest rate of new HIV infections in the country, and we had this huge opioid crisis. After the pill mills closed, there was lack of access to opioids. People were pushed towards using street drugs, and then they had no access to clean syringes.
If you got your drugs and you're an IV user and somebody else has a needle and you don't, you're not going to not get your fix because their needle's dirty.
We've handed out about 90,000 needles. We've done hundreds of HIV and hepatitis C tests. We've been able to link people to care for HIV. And we've also been able to get people into substance use disorder treatment.
Originally, they were helping me to keep my habit, for me to do it as safely as possible. But when I found out about the treatment options, and I took advantage of that almost immediately, I was able to get clean, I was able to get my family back, I was able to get off the drugs.
Syringe exchange programs cost very little and save the public millions of dollars.
When I have a patient in the hospital who has endocarditis, which is an infection of the heart valves that comes from using dirty needles, just that person's hospitalization could pay for a needle exchange program to operate for an entire year. And that's one person.
We have one of the largest overdose rates in Palm Beach County in the state of Florida. I see this needle exchange program as absolutely something that we need to support and make happen.
So all we're doing is like, here's something that can help stop disease. Here's something we can do that costs a few cents. So why don't we just do that? And the only reason to not do that is if you don't think those people are worth helping or saving. So, I mean, that's where it becomes like a human rights issue for me. It's like these lives are worth saving.
What kind of family does a drug user come from? Well, you can come from any family. These kids could not have been loved more. They couldn't have.
There is going to be a huge fight as we make a meaningful response to the opioid epidemic nationwide. And any response has to include needle exchange. If you're not including harm reduction, you're really not addressing the problem. If you're not looking at HIV prevention, if you're not looking at overdose prevention, the handing out of the naloxone, you're really just not doing anything for the opioid epidemic.